today we are going to deal with the internal. We're going to deal with the internal carotid artery. So internal carotid artery, and we are going to look at the branches. So to start off with a few questions, the first question we would like to ask is, in case of the petrous part, what are the branches? Then the second question will be in case of the cavernous part. So in case of the cavernous part, what are the branches of the ICA? And the third question we want to ask is in case of the cerebral part. In case of the cerebral part, that is the supracavernal part, what are the branches? So in this video, you'll find the answers to all these questions. And in the end of the video, we'll also have some bonus questions. So to start with, we are looking at the cervical part. So what is the cervical part? What does it say? So the cervical part, we are looking at the course. So firstly, the course. So in case of the course, it originates from the bifurcation of the common carotid artery. So it originates from the bifurcation. So bifurcation of the common carotid artery. So we saw it originates from the bifurcation of the common carotid artery, and what it has is it has a dilation. It has a dilation at the lower end. So at lower end they have a dilation, and it is known as the carotid sinus. Carotid sinus. And it ascends in front of the transverse process. So next it ascends in front of the transverse process. Okay, it ascends in front of the transverse process of the upper three cervical vertebrae, of the upper three cervical vertebrae. Now looking at branches, what are the branches of the cervical part? And the answer is there are no branches of the cervical part. Next, after the cervical part, we look at the petrous part. So what is the petrous part? So looking at the petrous part, they have, it is nothing but the course is, it passes through the carotid canal. So it passes through the carotid canal. It passes through the carotid canal, and it is present in the petrous part of the temporal bone. Petrous part of the temporal bone. Next is, what are the branches of this? So the branches of the petrous part is that. So what is the branches? So branches of the petrous part, it includes the caroticotympanic branch, as well as the artery, to the pterygoid canal. So next we are going to look at the next part, that is a cavernous. So the cavernous part. So the cavernous part, the course is that it runs in the cavernous sinus. It runs in the cavernous sinus. So what are the branch of this? So the branches is that it includes the branch to the trigeminal ganglion, branch to the trigeminal ganglion, and next there is also the meningeal branch. Out of the meningeal branch, there also comes the branch to the cavernous sinus, and after that there is also the hypothalamus physial branches. Then we move on to the cerebral part. The cerebral part or the supracavernal part. So in case of the cerebral part or the supracavernal part, the course is that it enters the subarachnoid. So it basically enters the subarachnoid space and it pierces the arachnoid matter. So it pierces arachnoid matter, and after piercing the arachnoid matter, it divides into two parts. So it pierces the arachnoid matter, that's what we saw. After piercing, it gives into the anterior bulge. So it gives the anterior as well as the middle. So what is this anterior and middle? Anterior and middle, this is the cerebral arteries. Cerebral arteries. So after giving this, now we look at the branches. So what are the branches of the cervical part or the supracavernal part of the inferior carotid artery? So the branches, it includes the ophthalmic. There is the ophthalmic artery, and after the ophthalmic artery, there is also the anterior choroidal artery. Anterior choroidal artery. And next, we also have the posterior communicating artery. Now we will jump back and we will answer our questions. So initially we asked 3 questions. So we are going to answer all of them. So the first question we asked was in case of the petrous part. Petrous part of the ICA, what are the components of this? That is the branches. So the branches specifically it includes, there is a carotico-tympanic branch. Next, there is also the artery to the pterygoid canal. The next question is, what are the branches of the cavernous part? So cavernous. So under cavernous, what are the parts? So cavernous, it has the branch. There is a branch to the trigeminal ganglion. The branch to the trigeminal ganglion. This is one. Next, there is also the meningeal branch. So there is also something known as the meningeal branch. Then after the meningeal branch, there is also the branch. This branch to the cavernous sinus. Branch to the cavernous sinus. And lastly, there is also next there is one branch known as the hypophyseal branch. Then we move on to the cerebral part. And also known as a supracavernal part. So here, what are the branches? It includes the ophthalmic artery. Next, it also includes the anterior choroidal artery. Next, the posterior communicating artery. So these are the answers to all our questions. Now we also have some bonus question which we would like to ask. So the bonus question is that what is the course? So we only have one bonus question for this video. So what is the course of the cervical part of the inferior carotid artery? So this question's answer can be written in the comments.